Oral rehydration solution. Rehydration solution. So our today's topic is oral rehydration solution. When it is given, it's mostly given when there is like deficiency of like electrolytes due to dehydration. Is mostly then we give oral rehydration therapy. So in this we will talk about the ORS composition and home preparation. How can we make it at home, which is very necessary in like day-to-day life, especially for children and adults. They are for home treatment, and it is a commonly asked question in nursing vivas in schools, colleges. It's very common. So first we will know the osmolarity. So the thing is that any fluid which is like closer to osmolarity of blood, it's more effective, right? It will be more effective, easily absorbed for our body. So first we need to know what's the osmolarity of our blood. Normally we have an osmolarity of 275 to 295 millimole osmol per liter. This is an isotonic solution. If you guys need to need another video of about different type of solution, let me know. I will provide it. So the fluid osmolarity of isotonic solution lies in this range only. So for example, if the osmolarity of RL is like Lingeratrix solution is 273 mole osmoles per liter. That's why it's a fluid of choice for a lot of conditions, because that's the osmolarity like which is like closer. For generally for isotonic solutions, osmolarity is 245 to 370. So for ORS, as we know, this is like the blood concentration, and this is like for the solutions, so which are like good for our bodies. Obviously anything which is closer to the blood composition will be more suitable. So for ORS the osmolarity is 245 mole per liter. So then it's very suitable because it's lying on the range of our blood osmolarity, right? Like it is closer, it's not in that exact, but it's closer, so it's suitable for our body and we can recharge all our electrolytes. So now to know the contents which it has, like if you zoom in the image, you will see here like packets. Generally you will find packets of rehydration that will like observe, like we have sodium chloride, potassium chloride. So let's know in details. First of all, glucose osmolarity present in ORS solution, which is isotonic, by the way, is 75 osmoles per liter. Sodium chloride positive ions 75, chloride negative ions 65 osmoles per liter. Citrate 10 osmoles milliosmoles per liter. And potassium 20 osmoles per liter. And if you see that the sum of all this is 75, and this is also 75 which, so it's a short way to remember the contents. If you need to remember, you can remember like this. You can give a mnemonic G N C, P, and you can remember everything is first two is 75 75, then the sum of the total is to be 75, to remember it in very effectively. So that it's mostly, now you have to know that in grams, like it's in osmolarity we have talked about, in grams what it will be. So in a ORS packet, in this small ORS packet, what is the ideal ratio according to WHO? It is should be glucose 20.6 grams, KCl that is 1.6 grams, NaCl 2.6 grams, Na citrate, like it's sodium citrate. Sodium is in two forms. First is in form of a salt, sodium chloride, then it is in a form of sodium citrate, which is 2.9 grams. Chloride is in the form of potassium chloride. So we are getting chloride and potassium. So all this need to be diluted in 1 liter of water or H2O. Otherwise it's not effective. Many times many mothers comes, they diluted less or more, which impact their osmolarity and their dissolving power in the body, and which is very harmful. So we have to educate about it, and you will see so many brands of ORS in the market, and they are, you will see in small liters, they are not to be medically advised because they are not following the correct formula, which can impact their child. I have seen children come in the hospitals, we have advised ORS, but they are not preparing it properly, and ultimately the child died of diarrhea. So that's the problem. We need to advise them and indicate them that you need to buy an ORS packet and dilute in 1 liter of water and drink it within 24 hours. Within 24 hours they have to drink it at least, and how much they require. So but suppose someone is not able to buy the ORS or is not available in government hospitals, so what we can advise at home, how we can prepare according to how WHO guidelines. In 1 liter of water, 1 liter of water, if they don't know how 1 liter of water, you can say 4 glasses boiled water. Okay, it needs to be boiled or purified water at home. Drink that within 24 hours. But the preparation, how will you make? 6 tablespoons sugar. You will get glucose from that. Sugar is easily available at home. It will be 30 gram. Okay, but how will they know, how will they measure it's 30 grams? So tell them it is 6 tablespoons. You will get like 5 grams per spoon. Then half tablespoon salt. From salt they will get the NaCl for requirement of sodium and chloride requirement, and half lemon. As you know, lemon has citric acid, so we can get citrate from that. It will for our all the for all the balance of electrolytes in our body. But have you noticed there is one thing missing? What is potassium? How are we going to get potassium? So we will advise take this with 1 liter of water plus 1 banana, as banana is rich source of potassium. It has a huge quantity of potassium. So we will say advice for mild dehydration that you can take it. In what conditions we are giving indications, water, electrolytes, and energy loss, vomiting, diarrhea, weight loss. You know, like when there is deficiency of electrolytes in our body, someone is vomiting, they are vomiting all the contents from their body, from the gastrointestinal tract. So there is loss of electrolytes. Same with diarrhea. And so suppose someone is doing heavy workout in a very sunny day, running outside, they are losing their electrolytes, they need it, they need the supplements, they are doing heavy workout, they have sudden weight loss, electrolytes may be also lost because they are like so focused on like losing the weight. So thank you for today. I hope I made this topic very easy for you guys. Let me know if you know any more topics, and do subscribe.